Hello guys, welcome back to my YouTube channel and welcome to this series of what is inside the ANC booklet. And today I have a question for you. Have you ever asked yourself why we as healthcare workers or we as midwives, we always ask you about your previous pregnancies and about your previous deliveries? Do you think there is any connection with the previous deliveries and the current pregnancy that you're carrying? Do you think there is any importance of us knowing what you had to pass through during your previous deliveries and during your previous pregnancies? Now, this is what we are talking about, and today I will let you know why it is so much important for us to be able to understand each and everything that you went through and that you passed through during your past pregnancies and during your past deliveries. So let's talk about our past obstetrical history. So guys, I don't know whether you can see here, we have a table here, and this is where we get to record your past obstetric history. So this table is where we record all your previous pregnancies and all your previous deliveries, whether you delivered a live baby, whether it was an abortion, whether it was a miscarriage. We really need to know. That is what we call obstetric history. We really need to know all of that. How many pregnancies have you carried? How many deliveries have you delivered? How many babies are alive? How many hours did you go into labor for each and every pregnancy? So this table here, we get to, there is somewhere a column written first. So this is where we record your first pregnancy. And what is all about your first pregnancy? Number one, year. Which year did you carry the first pregnancy? If it was 2020, you record here 2020. The second thing is number of times ANC attended. How many times did you attend the ANC visits? At least we want to have an idea of, are you those clients or are you those moms who never even bother to go for ANC clinics, you know, so that even later on when you tell us your baby is not okay up to date, we can be able to relate. Or you didn't go for your ANC clinic, you didn't take the iron, the ferrous and all that, you know, that is why probably the baby is not well, is not okay. So we need to know how many times did you attend your ANC clinic. The next thing is place of delivery. Where did you deliver your baby? Did you deliver your baby in a hospital, or did you deliver your baby at home, or even maybe on your way to the hospital? We need to know. If you delivered your baby at home, was it intentional? Did you know, or is it that you didn't even, you were not even aware that you are in labor? That is why you ended up delivering at your home. We need to know that. Then the next one is maturity. How mature was that pregnancy when you gave birth? Was it 37 weeks? Was it 36 weeks? Was it 40 weeks post-datism? Was it a preterm baby? We need to know. How was this baby term when you were giving birth, that first pregnancy, okay? Next issue is duration of labor. In that first pregnancy, how many hours did you go into labor? Your labor started at 7 p.m., you delivered the next day at 10 a.m. We need to know how many hours did you labor. Did you labor for 20 hours? Did you labor for even 2 hours? Was it a precipitate labor? We need to know that. Then type of delivery. How did you deliver your baby? Was it an assisted delivery? Was it an assisted or vacuum delivery? Was it a normal delivery? Was it a CS delivery? We need to know how was your delivery in that first pregnancy. Then the next one, birth weight. What was the birth weight of your first baby? Was it 4 kgs? Was it 3 kgs, 1 kg, 2 kgs? We need to know, at least to know whether you have any history of big babies or small babies, you know. Then the sex, what was the sex of the baby? Is it a male? Was it a female? Then outcome. What was the outcome of the pregnancy? Outcome, was the baby alive or was the baby dead? We need to know that. That is what we mean by outcome. How was the baby? Was it alive? Was the baby dead? Then The last phase is puerperium. Puerperium is postpartum period. So we need to know, how was your postpartum period? Did you experience any problem, any emergencies, any issues? Did you have a lot of bleeding? Did you have any abnormal issues with you? Any abnormal bleeding, back pains? Was your puerperium period just a normal period like any other woman after delivery? We also need to know. So that is it all about that. So on each pregnancy, we have to feel that. So for the first pregnancy, the second pregnancy, we ask you the same history. The third pregnancy, we ask you the same. The fourth pregnancy, we ask you the same. So now let me explain why we need to ask each and everything of these. So the first part we have said, it is about the year. Which year did you deliver? Let's give an example. You having 5 children. I need to understand you as my client now, you as my patient. So we are in 2026 when I'm shooting this. It is 2026. And I'm taking an example of someone who has 5 children. When we are in 2026 and you're telling me you already have 5 children, it shows me that you have delivered each and every year. So 2020 you have a baby, 2021 you have a baby, 2022 you have a baby, 2023, each year you have a baby. To me, I will already understand that you must be having a lot with you. And probably maybe this pregnancy were not planned, okay, because it means you didn't even have enough time to even breastfeed those babies the way it should be. So I need to know those years so that I already study you. I know how you are even mentally, and also how your body is. And also I need to know, was these years planned pregnancies or did they just happen? Then the next one is number of attended ANC visits. I've talked about that. I need to know, are you the kind of mom who will follow up with the clinics, at least take the ferrous, sulfate, ferrous and iron, at least those moms who normally go to take the tetanus injections. So I need to know, did you go for NC clinic? Did you get those injections? Did you follow up with whatever we do at the ANC clinic? It is good so that I know how to approach you concerning this current pregnancy. Then the next one is a place of delivery. I have explained that. About the place of delivery, I have explained that. Then maturity. I need to know the previous pregnancies. Are you the person who goes into preterm labor? Because we have women who have history of going into preterm labor. Each and every time they are pregnant, that their pregnancy do not reach term. I mean, they get preterm labor. So I need to know how has been your previous pregnancies. 38 weeks, 40 weeks. Some of you mostly go into postdatism until you even go for induction of labor. At least I need to understand that so that I also prepare you for this pregnancy. Maybe if you have ever had previous preterm labors, we will do investigations on why you have been going on preterm labor, and then we get to see how we can take care and protect this current pregnancy so that you get to reach term, at least not deliver in preterm labor. Then duration of labor. Duration of labor. The reason why we mostly ask about duration of labor, we need to know so that we get to prepare you psychologically for this current pregnancy. So for the duration of labor, we need to know how many hours did you go into labor? How many hours? There are those mothers who have precipitate labor. Precipitate labor is where you start labor like right now, let's say it's 10 a.m. Then within 2 hours, 3 hours, you have already delivered your baby. That is a precipitate, or it is a very fast, abnormally fast labor. Because labor should be, we believe, or what it is, we believe that you should be dilating 1 centimeter in every 1 hour. So if you are at 10 a.m., you are at 2 centimeters, then it means at 11 a.m. you'll be 3 centimeters, at least a centimeter each and every hour. So for you to be 2 centimeters at 10 a.m., then deliver at 12 p.m. or 1 p.m., that is precipitate labor. Your labor has gone so fast, abnormally fast. I as your midwife, I need to understand, are you that type of a mom who gets precipitate labor? So that when you're coming into labor ward, and remember, this information will be recorded, and this book, I will have to admit it, yeah, with you, to admit you in maternity ward using this book. So meaning when you come to the labor ward, I will study this booklet and I will have this information at the back of my mind. So in case I see you having contractions, in case you are in labor and I see you having contractions, I remember what is clicking in my mind is you always have precipitate labor, meaning I need to be closer and closer and more closer to you, especially when you start saying that you have contractions. To me, I will be like, hey, if you're feeling the contractions, then it means the baby is already coming out. So that is why it is so much important, so that your midwife will know how to manage you when you are in labor now. Okay. Then the other one is type of delivery. Did you have a normal delivery? That is, we call it spontaneous vaginal delivery. Or did you have a CS delivery? That is the surgery. Or there are those deliveries we call assisted or vacuum delivery. Maybe or your baby was too big and you didn't have more energy to push out the baby. So your doctor or your midwife had to use a vacuum to remove your baby. We need to have that history so that when you're coming into labor, I as your midwife, I have this information in mind. So when you are in labor and when it is time to, at least when we are approaching to deliver you, I will be ready, at least maybe even prepare the vacuum around me, prepare the doctor, and all that, even prepare the resuscitation, just in case whatever happened maybe will repeat itself. So it is good that I as a midwife get to have this information. For those who have delivered through cesarean section, that is surgeries, yes, you definitely know that most of the times we do not advocate for you going for another normal delivery, a normal delivery after a scar. Most of the times now we will plan for an elective CS. In case you had a CS, we will plan for an elective CS. Reason being, we do not want you to go into labor with a scar, because what happens when you are in labor, during the contractions, it is the uterine muscles, the muscles of the uterus, they do like this. They pull each other, So you can imagine where the scar is, and probably maybe inside there, at the top here, physically you can feel as if you're healed. But inside there, inside the uterus, we are not sure how the muscles are. Did the muscles heal well? Then you can imagine where there is a scar, and that is where the muscles are contracting. So there is a very high probability of the scar bursting or the scar getting torn, which is not okay. So that is why most of the times, in case you have had a CS delivery, we do not advise you to go for a normal delivery with a scar. Okay. Then the next one is the birth weight. Birth weight, how is it important? We have mothers who deliver big babies. Like we have mothers who deliver babies 4 kgs and above, 4 point something, 4.5, 6 kgs, 5 kgs. So I need to know, are you such kind of a mom? So that during labor, I get to prepare well. I get to prepare the other staffs. I mean, like this mom always delivers big babies. We need to be nearer there. And also for those who deliver big babies, we also need to check out your blood sugars, because also diabetes is related to a mom delivering very big babies. Okay. Then also, even for the small babies, are you the type of mom who delivers small for gestational age babies? Like it is a term baby, but it is 1 kg. It is a term baby, but it is less than 2 kgs, that is quite abnormally low. So we need to have that history so that we get to investigate why do you deliver the very small babies despite the pregnancy having gone to term. So these are information that we as midwives, we really need to know so that we know how we can help you with the current pregnancy. Then, of course, the sex of the baby. Here, a lot of moms will not understand why a nurse will want to know the sex of the babies that you have delivered previously. I myself, as a midwife especially, who loves moms and loves sharing a lot of issues with moms, I always ask this because most of the times, maybe you have delivered 3 boys, so you are anticipating for a girl. So mentally and psychologically, you're so down and you're tense, you are in anxiety because you are not sure whether you're going to deliver a boy or a girl. So it is good that I know so that also when I'm taking you through labor process and also delivery, I will be able to just encourage you. Ni nini unaniita na sijamaliza? Eh? Na ufunge. Funga hapo mlango ukitoka. So I will be encouraging you, and also just help you mentally, psychologically with that. Okay, so it is good when you have the opposite sex and you don't care, like you don't mind having any sort of the baby. Also, we know there are those moms, by the way, especially for someone who is anticipating to deliver a certain sex of a baby. Maybe you just want a girl, and then there we are helping you deliver the baby, and the baby is out, and then it is time for me to show you the kind of the baby you have delivered. I've seen a lot of moms neglecting babies right from that point. Like, you're showing the mom you have a boy and they really wanted a girl, and they're like, no, I don't want that, take that baby wherever you want to take them. And it is so traumatizing. So at least when I know that history, when I know what you want and what you have already had, at least I will know how to approach you. Even at that moment that I'm showing you your little one, I will know how to approach you at that moment. Okay, so it is important. Then outcome, was the baby dead or alive? Yeah, it is good that I get to know. Did you have to carry a pregnancy and then deliver a dead baby? We need to know this so that mentally, psychologically, I be able to encourage you to we work together during this current pregnancy. And also, if the baby was dead, we always do investigations just to just to get to know and to understand why did the baby come out dead, so that we can put the measures as much as possible. We can do whatever we can do to make sure that this time round you deliver your baby alive. So it is important. Okay, then puparian period. It is important that I know, did you have a normal puparian period? Did you have excessive bleeding? Did you get to experience postpartum blues or postpartum depression? So that we get to prepare you as early as when you're pregnant for this current pregnancy, so that when you're delivering, we also make sure that we put the measures that are set. We set some measures so that we ensure that now this current pregnancy, after you deliver, your preparing period will be a normal one. So all this information is so much important to us, even to you, because at the end of the day, it is you who is going to get help. We are doing this, we are asking about all this so that we get to prepare very well, because we want you to not to suffer as you suffered with the previous deliveries and with the previous pregnancies. We are doing this, we are taking this history so that we can be able to help you to carry this current pregnancy with so much grace and also successfully. So anytime, I always say and I repeat, anytime you're coming to the ANC clinic and I ask you these questions, please kindly be kind enough, and also just take your time when you're giving me the answers to this, when you're responding to all these questions, because at the end of the day we want to do this because we want the best of you and also the best of your unborn baby. So until our next video, kindly let me get to know in the comment section, is do you want still to, and is there anything that you have not understood? Is there any question that you might be having concerning the ANC booklet? Kindly ask me, or just write it down below in the comment section, and I promise that I will get to answer it in my next video. Thank you.